Cardiologist warns, 7 nail signs after 60 that may reveal heart disease early. Before you do anything else, I want you to stop for a moment and look at your hands, not casually, but really look at them, because what if I told you that your fingernails may already be showing early warning signs of heart disease, circulation problems, or even increased stroke risk long before you ever feel a single symptom? And most people over the age of 60 completely miss these signs until something serious happens. Today, I am going to walk you through what experienced doctors quietly observe in clinical practice but rarely have time to explain in detail, and I will show you how to recognize these subtle changes in a simple, practical way that could genuinely help you or someone you care about. But before we begin, if you value your health, if you want to stay independent as you age, and if you want to learn simple signs your body may already be giving you, take 1 second right now to subscribe to this channel, because every week we share clear, practical medical knowledge designed specifically for adults over 60. And while you are here, I want you to tell me in the comments your age, and whether anyone in your family has ever experienced a heart attack or stroke, because your experience may help someone else realize they are not alone. Now stay with me until the very end, because the last sign I will show you is something you can check in under 10 seconds, and it may reveal circulation problems most people never think about. Let me start with something important that most people misunderstand. Your fingernails are not just cosmetic parts of your body. They are actually living indicators connected to one of the most sensitive vascular systems in your entire circulation network. Under each nail is a structure called the nail matrix, and beneath that is a dense bed of microscopic blood vessels called capillaries. These capillaries constantly deliver oxygen and nutrients to growing nail tissue. And because they are so small and sensitive, they are often among the first places in the body to show subtle changes when circulation begins to slow, when the heart has to work harder, or when oxygen delivery becomes less efficient. In younger adults, the body has strong compensatory mechanisms that can hide these changes for years without visible symptoms. But after the age of 60, those compensatory systems weaken and small changes begin to matter much more. This is why experienced clinicians sometimes pay attention to nails during physical exams, because they can provide early clues about cardiovascular stress long before serious symptoms appear. But it is important to understand that none of these signs alone diagnose disease. They are simply signals that may warrant attention. The first sign is called Terry's nails, and once you understand it, you will start noticing it more often than you expect. In healthy nails, the color should be a soft pink because of normal blood flow underneath the nail bed. But in Terry's nails, the nail becomes unusually pale, opaque, or almost completely white with a cloudy appearance that resembles frosted glass. And what makes this pattern more specific is the presence of a narrow pink or reddish band at the very tip of the nail. That thin band is an important visual distinction because it helps separate Terry's nails from simple nail discoloration caused by aging or external factors. Research has associated Terry's nails with conditions such as heart failure, coronary artery disease, diabetes, and chronic systemic illness, and while not everyone with this nail pattern has serious disease, it is considered a potential warning sign that deserves medical attention, especially in older adults. I once cared for a patient in his early 70s who came in complaining only of mild fatigue, nothing alarming, no chest pain, no acute symptoms, just a feeling that his energy was not what it used to be. But during a routine examination, I noticed that his nails had a pale, frosted appearance with that subtle reddish band at the tip. That small observation led us to order further testing, and we discovered early-stage heart failure that had been developing silently over a long period of time. Because it was detected early, we were able to begin treatment before more serious complications developed. And this is a powerful reminder that small physical clues can sometimes reveal important internal changes. The second sign is called Lindsay's nails, also known as half and half nails, and this is one of the more visually striking patterns once you know what to look for. The nail appears divided into 2 distinct color regions where the upper portion near the cuticle looks pale or white while the lower portion near the tip appears darker, often reddish, brownish, or pinkish, and the dividing line between these 2 zones is usually sharp and clearly defined. This pattern has been associated in clinical research with chronic systemic conditions including kidney disease and cardiovascular disorders, and what makes it particularly important is not just the appearance but the way it develops slowly over time. Because when changes occur gradually, the brain tends to adapt and stop noticing them. This is known as sensory adaptation, and it is one of the main reasons people miss early warning signs in their own bodies. They do not ignore the change intentionally. Their perception simply adjusts until the change feels normal. I have seen this many times in older patients who only realized something had changed after it was pointed out during an examination. The third sign is Muehrcke's lines, and these appear as horizontal white bands across the nail, but there is a key feature that makes them different from other nail markings. They are not raised and cannot be felt when you run your finger over them. They are purely visual, and this detail is clinically important because it suggests the changes are not on the surface of the nail itself but are related to underlying physiological conditions. Muehrcke's lines have been associated with low albumin levels, nutritional stress, systemic illness, and in some cases cardiovascular strain. I once saw a patient who thought these lines were just a harmless cosmetic change due to aging. She had no other symptoms and felt generally well, but during further evaluation we discovered early signs of cardiac dysfunction that had not yet produced noticeable symptoms. Because we identified the issue early, she was able to receive appropriate care before the condition progressed. The fourth sign is Beau's lines, which are very different because instead of color changes they appear as deep horizontal grooves or indentations running across the nail plate. These grooves represent a temporary interruption in nail growth caused by a significant physiological stress event. This could include severe illness, infection, surgery, or even a silent cardiovascular event that temporarily disrupts normal bodily function. When the body experiences significant stress, it can temporarily pause nail growth, and when growth resumes it leaves a visible groove that slowly moves forward as the nail grows. In some cases the position of these grooves can even help estimate when the stressful event occurred, which is why Beau's lines are sometimes considered a timeline of past health stress. This is particularly relevant in older adults because silent heart events are more common than many people realize, and symptoms are often subtle or mistaken. For general fatigue or aging, the fifth sign is splinter hemorrhages, which appear as thin dark red or brown lines under the nail that resemble tiny splinters embedded beneath the surface. While a single line caused by minor trauma is usually not concerning, multiple unexplained lines across different nails can sometimes indicate more serious conditions, including inflammation or infection affecting the heart valves. In such cases, tiny particles or clots can travel through the bloodstream and become lodged in small capillaries under the nails. This is why doctors take this finding seriously when it appears without a clear injury. The sixth sign involves the lunula, which is the small crescent-shaped area at the base of the nail. Many people barely notice it, but changes in its appearance can sometimes reflect underlying health issues. A bluish tint may suggest reduced oxygen delivery. An unusually red lunula may in some cases be associated with cardiovascular stress. And a disappearing or faint lunula can sometimes be linked to anemia, and anemia is important because it forces the heart to work harder to deliver oxygen throughout the body, which over time can contribute to fatigue and cardiovascular strain, especially in older adults. Now, before we move to the final and most practical sign, I want you to understand something important. None of these signs should cause panic. They are not diagnoses. They are simply signals that can help you become more aware of your body and potentially identify when something deserves medical attention. Now let me show you something extremely simple you can do right now called the capillary refill test. Press gently on one fingernail until it turns pale. Then release and observe how quickly the pink color returns. In healthy circulation this usually happens within about 2 seconds, but if it repeatedly takes 3 to 5 seconds across multiple fingers, especially in warm conditions, it may suggest slower circulation or reduced cardiovascular efficiency. And while this is not a diagnostic test on its own, it is something that doctors often consider alongside other findings. I once had a patient who tried this test at home and consistently noticed slow refill times. He decided to seek medical evaluation and was diagnosed with an irregular heart rhythm that he had no idea he was living with. Treating this condition significantly reduced his risk of stroke even though he had no symptoms at all. So here is what I want you to do starting today. Go to a place with good natural daylight and carefully examine your nails one by one. Look for pale or cloudy discoloration, sharp two-tone patterns, horizontal lines, grooves, tiny dark streaks under the nail, or changes in the half-moon shape at the base of the nail. Then take one additional step that most people never think about, which is to take a photograph of your hands today, because gradual changes are extremely difficult to notice day by day but become obvious when compared over time. And if you notice 1 or 2 signs, do not panic, but mention them to your doctor during your next visit. However, if you notice multiple signs together, or if changes appear suddenly, do not delay medical evaluation because early assessment is always better than late intervention. And finally, before you leave, if this information helped you understand something new about your health, please subscribe to the channel and share this video with someone you care about, especially if they are over 60, because sometimes a single piece of information arrives at exactly the right moment and makes a real difference in someone's life. And now tell me in the comments, did you check your nails while watching this video, and did you notice anything unusual, because your body is constantly speaking in quiet signals, and once you learn how to recognize them, it may reveal more than you ever imagined.